Welcome back to the show. We're talking about ankle replacement surgery with Dr. Fox and Mr. Johnson. Dr. Fox, before the break, we were discussing fusing a joint versus the new technology of an ankle replacement that we do at Shore Memorial. Now let's talk about the patient comes in to choose to get an ankle replacement. What would they expect with their hospital stay and their post-op recovery?
There's, as I said earlier, there's a 2 to 4 day hospital stay. Okay. Some patients, depending upon the home situation, some patients may go to rehabilitation facility afterwards. One of the big differences between hip and knee replacements and ankle replacements is the post-operative care. With hip and knee replacements, patients are expected to walk almost right away. With an ankle joint replacement, because of the smaller area, it has to be the patient needs to be non-weight bearing for approximately 6 weeks after the surgery. So the surgery's over, we put them in a cam walker boot, which is an immobilization boot. The stitches come out at 2 weeks, and then at 3 weeks, we send the patients to physical therapy, such as we have at Shore Memorial Hospital, for gentle range of motion exercises, non-weight bearing.
Okay.
At 6 weeks post-op, we start graduated weight bearing. The physical therapist would gradually allow the patient to bear more and more weight till they're weaned from the walker or the crutches. Usually that takes 2 to 3 weeks, again, depending upon the patient. And then gradually after that, you can get back to their normal activities. But the normal activities that's important to remember need to be low impact. High impact activities are not allowed after an ankle joint replacement surgery.
Mr. Johnson, how was your post-op recovery after the ankle replacement? How long did it take you to start getting about your activities?
Month to 2 months. Then you just slowly get back into it.
How's it feel compared to before the surgery?
Feels a whole lot better.
Feels a lot better.
Yeah.
How's your range of motion moving the ankle?
Good.
You have good range of motion?
Yes.
Okay. And did that improve as you moved it into physical therapy? Great. So, Dr. Fox, what would be some of patients who get this type of surgery, some things they'd be worried about, like complications post-op?
Okay, every surgery has potential complications. In this particular surgery, we divide the potential complications into early and late. Early complications are things that might happen from the surgery itself. For example, the post-operative infection, the incision doesn't heal properly, or there's a blood clot, maybe the superficial nerves around the incision might get damaged. Late potential complications would be things like loosening of the prosthesis, where it gets loose in the bone, or that over time the plastic that's between the two bones would wear out and have to be replaced.
Okay. Mr. Johnson, did you have any problems with any complications or problems?
No, I got a little infection, but it was nothing major. They took care of it very well.
Got better with antibiotics?
Yeah, he wound up having intravenous antibiotics for a few weeks, and the incision closed up and it healed nicely.
Which everyone should know that any prosthetic joint we put in has a risk of infection.
Correct.
Whether it's a hip, a knee, an ankle.
Every surgery has a risk of an infection. The thing is with a prosthesis, we jump on them quickly because you don't want to have to take the prosthesis out.
Now, in the long run, somebody like Mr. Johnson, what are his limitations? What things can he not do?
Okay. He's limited to what we call low-impact activities. That means golf would be okay, jogging is not okay, swimming is okay, biking is okay, basketball is not okay, singles tennis is not okay, but maybe doubles tennis, depending upon what kind of a game you play, might be okay. But high-impact activities, anything that involves running or jumping, you're usually precluded from doing that after the surgery. So most of these patients were not able to do that before the surgery, but they have to be. But if a patient comes into me and says, well, I want to have this replacement surgery so I can jog again, it's my job to explain to them that that's not going to be possible.
Yeah. And after they've had the surgery and they limit their activities, you said about a 15-year time window for the replacement, or how long would they expect to?
If they're compliant and they follow instructions and limit themselves to low-impact activity, the plastic would last probably 15 to 20 years. But the plastic can be replaced. If this plastic piece wears out, it requires another surgery, but it can pop out, and then we can pop another newer plastic in there. If this loosens inside the joint, then what we have to do is replace it with a bigger piece or something like that. But usually talking 15 to 20 years.
Yeah. which is a long time.
Right. So I mean, even hips and knees are not made to last for 30 or 40 years.
Yeah. Well, thank you guys very much. Thank you for joining us on the show today.
Our pleasure.